Hello everybody, this is Joe Ninami again. Today we're going to talk about a special topic, and that's mental health, concussions, and more severe traumatic brain injuries. One of the things that happens with mental health and these injuries is that there's some confusion because they overlap. And if a mental health person is not sophisticated or has the knowledge of TBI or concussions, there can be misdiagnosis. And that's very, very critical and important for the patient to know what's going on, as well as the mental health person. So I'm going to go over some of the main topics, not all of them, but main topics. The first part that we've seen is emotional changes. Yes, emotional changes. You can have all the way from emotional ability, which means they hard to control their emotions. They cry or they laugh at the drop of a hat, and not for any particular reason. On the other hand, you go exactly opposite, or lack of emotions. They're not as friendly. They don't enjoy as much company. They don't seem to show emotions at all. The other one is exaggerated emotions when the topics are brought up, all the way to apathy. In other words, they just don't get it. Now, with that, you also have other emotions such as anger, depression, and anxiety. That's all affected by concussions and traumatic brain injuries. And here's the thing. A lot of times it's missed because with the traumatic brain injury, you can see the differences and measurements in the CT scans, the MRIs. Yes, you can see that, but on concussion, we have what we call micro tears, really tiny tears, or even small bleeds that's not measurable. And so a lot of times people, they don't even go to the hospital after they get hit in the head, they get a large lump on their head, or get knocked out for a few seconds. They say, oh, I'm fine now. But it may have lasting damage. And we can measure those damages by the behavior. Another thing that happens with these emotional changes is that the social skills also decrease. And the social skills may be a little off and not consistent with that person. There we go. Personality changes. There's some slight personality changes that you can't put your finger on. And you know there's something different, but for the majority they're the same person. On the other hand, there's also another problem with people that have mental health issues. Sometimes the symptoms are exaggerated, get more of the same issues that the person suffered prior. Another thing other than the emotional area is the cognitive area. Sometimes we have short-term memory problems, memory lapses, forgetfulness, attention problems. All these things can affect a person and how they deal with life. With all these things put together, we have social problems. A lot of times with brain injury, traumatic brain injury, post-concussive syndrome, friendships are lost. And the person gets lonely, which increases more mental health issues. It's not uncommon for a person to have a lot of friends and very few friends, very long-lasting friends, and even those start to wear away and drop off. These are all the things that the mental health professional needs to be aware of, because if they don't catch it, they could be major problems for the patient. With all these problems, loss of friendship, personality changes, lack of motivation, all these things, we have what we call adjustment to disability. Adjustment to disability is how a person reacts and lives life after such an injury. A lot of times we don't even notice it. It could be so subtle that it's just enough change to make a person's life turn all the way around. Family members and close friends can probably measure a lot of it to a certain degree, but they can't put their finger on it. Strangers and new acquaintances, they'll tend to stay away, and it becomes a lonely life. So now from the standpoint of a lonely life, now we're affecting the self-esteem. It can also affect the motivation of a person. All these things with a post-concussive, a slight injury, with all these minor tears and all these minor problems, that's quite small, but major in affecting the person's life. Okay, everybody, we have a special guest today that has a question on concussions and traumatic brain injury.
Howdy, Joe.
Hey, how's it going today?
Going pretty good, Joe. Got a couple questions, though.
Okay, what are they?
Well, I got this friend who hit his head. He fell down. And lately, he's been kind of angry when we play video games.
Oh, did you ever go to the hospital, or did you just stay at home, or did you get looked at, or did he took any care about it at all, or what happened?
Well, he had a pretty big bump, but he said it wasn't the first time, so he just took a nap.
Yes, Oh, by the way, did you know that head injuries, when they're progressive, if you have one hit, the second hit makes it even worse yet. And if you have a second hit, you have a tendency to have even more hits. So what's going on with your friend?
Well, he likes to do hot yoga, and sometimes it gets pretty sweaty, he said. But he'll pass out and hit his head.
Okay, all right. And he has a lot of anger behaviors, huh?
Well, lately, yeah.
Yeah. So one of the things that happens with concussions and brain injury is that the personality changes a little bit. Did you notice that?
I did, yeah.
Okay. So whenever he gets angry, the best thing that you could do is really not to confront him with it, because that may make him more angry, but maybe redirect him. Something that's pleasant, something that you guys did in the past, something that you enjoy, that you can switch his mind to thinking about something different.
Yeah, I can do that. We also like, listen to music.
Excellent. Did you know that music is one of the best therapies that you can have, and it actually soothes the brain? So basically his attention will go to the music, which will also settle him at the same time, depending upon what type of music you listen to. Very good idea.
Yeah, I think I'll try that, Joe. Thank you.
You got it, my friend. Take
All
care.
right. See you later.
Bye-bye. All right, everybody, we had our friend. We talked about some of the deficits and things that he could do. Also, I would like to invite all of you to write a comment or ask a question about concussions or TBI, and I'll answer it, because a lot of times these questions aren't answered. And I've had like 4 years of experience. I've traveled throughout the country working with brain injury patients. So I'm here to help. All you gotta do is ask the question and I'll answer back. Take care. Bye-bye.